Before starting dermatology residency, I thought I knew what I was getting into. Skin diseases, creams, maybe some lasers. But I was wrong. There are about 3,000 skin diseases. 3,000. I don't think any medical student will realize this until they stand in front of OPD, see the patient, and realize this can be one of the 100 different conditions. Dermatology has more theory than people think. It's not just about recognizing a particular skin lesion and prescribing a medication. There is immunology, genetics, pharmacology, systemic diseases, all of this showing up on the skin. And many of these conditions are chronic. The patients don't just come once, they come back for months, for years, and sometimes for their entire life. This was the first thing the residency taught me. Dermatology is deeper than it looks from the outside. The hardest part of this first year wasn't the long calls or long study time. The hardest part was when I cannot do enough. There was a patient I saw who had giant wart in his perianal area. We followed the protocol. We did every treatment possible, but this giant wart was not going. Standing in front of the patient like that, realizing that medicine has its own limitations, is not something that we are prepared for. And about study, nobody will tell you how much you have to study in dermatology residency. This large volume of Rook's textbook of dermatology, you finish one chapter and other three are already in the queue to study. And study will never finish. First year, I lag behind almost every day while studying. But then there are other moments also that give you joy and small pieces of happiness. There was a patient with immunobullous disorder called pemphigus who was admitted in our hospital for 24 days. This is a condition in which the body attacks your own skin and there are blisters everywhere in your body. So I looked after her every day. I did her dressings, I managed her medications, and after 24 days, when she finally got discharged from the hospital, she was not the same person presented 24 days back. She was totally a different person with different glow and different skin. This kind of moment stays with you. Or something like removing a simple skin tag or acrocordon that had embarrassed the patient for years. It is just a 10-minute procedure. But when the patient sees himself or herself in the mirror with the removed acrocordon and feels happy about the skin, this gives tiny but precious moment of happiness. That's the part of dermatology what nobody usually talks about. This is small happiness, this is small moment of transformation that we collect in our account, in our memory forever. If I could go back before the time I joined residency and give myself an advice, that would be make your basics strong. Don't just remember. Understand the concepts, the morphology, the mechanisms, why a drug works the way it does, why a skin condition behaves the way it does. Everything else is built on the foundation. Everything. Now I'm going into second year. I know I didn't know a lot of things still, but I know this faculty better. I know this specialty better, and I know why I joined dermatology. If you are a medical student thinking of joining a dermatology as your specialty, or just curious about how dermatology residency looks like, I will be sharing more stories and more videos. If you are going through residency right now or starting to planning the residency, comment below what specialty you are inside. I would love to know. And if you find this honest, please subscribe me, because that's what this channel is going to be. Honest. Thank you for watching.